Good afternoon, everyone. And I'm the second last person holding you back from lunch. Okay? Please bear with me. I represent two organizations. One is the Indian Pharmaceutical Association Maharashtra State Branch, its education division, and second, our college, which is Bombay College of Pharmacy. We have heard a lot of things since morning in terms of what the problems are. I'm going to spend maybe half a minute talking to you about an old American Indian story where there was a forest, a beautiful forest with a lot of animals living very, very happily. And one summer when it was too hot because of the dry grass, there was a forest fire. And as soon as the forest fire was detected, all the animals started running away and telling each other, come on, let's go away from the fire. And as the animals were running away, the tiger saw a hummingbird kind of go in the opposite direction. And I was wondering, why is this hummingbird going the other way? Shortly after that, it saw the hummingbird come back, pass it, go further and again come back. And this hummingbird did that about 20-30 times till they were fairly far away, and it was continuing to do so. And suddenly the tiger stopped it and said, what the hell are you doing? We are trying to run away from the fire and you keep going back and forth. And I said, no, what I'm doing is going to the nearby river, getting a small bit of water I can carry and putting it on the forest. And the tiger was saying, how is that going to help? And the hummingbird said, the forest is mine. I love it. I don't know whether I can stop the fire, but I'm going to try. And as the spirits were looking at this thing happening, they were very happy and they decided to put a downpour and stop the fire. And that, they say, is miracles. If you look at what is happening since morning, it almost seems we need a miracle to change things. But then, rather than waiting for that miracle to happen, why don't we do our bit? What can we do to make it more patient-centric and more patient-driven? So Bombay College of Pharmacy, rather than kind of sitting back on what is the problem and trying to figure out what works, I said, what can we do right now? So there are two things we have taken up. We have an MOU, which Dr. Gupta and us have signed to develop an app. The app is designed basically to be in every language to give patient information about the medicines they are taking, and medicines they are taking not through Google, but through scientific literature, through our undergraduate students and postgraduate students, so that information is correct and to the point and should be delivered as it is supposed to be delivered. At the same time, we will also include information about diseases, the variants of the disease, and how to identify where you stand in there, so that you know what drug is being given to you and why. The second thing is we also realize that the age has gone from paper to digital. So we are working on actually introducing our own pharmacy students at the undergraduate and postgraduate level to the changing digital scenario by introducing an elective course which will talk about all the digital advancements that are occurring in the healthcare sector, so that these people can go in and start contributing in the real world and help the healthcare industry to become better and better. So those are the two things I want to tell you. We know patient needs us, but let us start doing something for them, however small it is. The other problems will get taken care of whenever they are supposed to. So our two things is, let us educate the patients, let us educate our pharmacists to be in touch with the modern times and start realizing how to use analytics, Excel, digital tools to help the patient understand what they are going through. Thank you very much.